In this video, I'm going to teach you how to assess your posture at home. First thing, we need a wall, preferably a white wall or something that is clear. Then you need to have clothes that is tight to your body. You can use shorts, you can be without a shirt or a sport bra, something that you see the contours of your body. You don't want baggy clothes when you're checking your posture, and you want to be barefooted, right? Now, what we're going to look at, you're going to take pictures of your posture, or you're going to do this in front of a mirror. It's good to have the picture so you can compare on the future. So first, you're going to take a picture facing forward, and you want to stand as normally as possible. You don't want to cheat and try to be as straight as possible because that's not how you stand. So you want to stand as normally as possible, like you will stand on the street. So how to do this? You're going to close your eyes and you're going to march in place. You're going to move a little bit, and then you're going to relax and stand normally. Boom, take a picture. Somebody's gonna take a picture of you. You can put your phone in automatic and that will take a picture. Okay? Then you're going to go from the side, do the same thing, move around, boom, take a picture. Then you go from behind, take a picture, and then you go to the other side and take a picture. Okay? Now, what we're going to be looking at for posture. First thing, we're going to go from the head down to your feet. Now, you want to check ear, that the ears are balanced and you don't have one ear higher than the other one. If you have one ear that is higher than the other one, that means that the occiput, the cranium, is translating, or your neck is bending to the side. So this should be the cranium. Sometimes the cranium translates in C1, okay? And sometimes it's the neck that is bending. Right? So the neck starts to bend and you will have that. Now the next thing is the shoulders. You want to see that your shoulders are balanced. You want to check the acromioclavicular joint right there, and you want to see if you have one shoulder that is higher than the other one or one shoulder lower than the other one. Okay? Now when you have one shoulder higher than the other one, that can be because of misalignments of the thoracic spine. The thoracic spine starts to bend to the side like that, and you might have one shoulder higher, or you might have tension on the trapezius muscle and the levator scapula that are going to lift the shoulder up, or you might have some ribcage translation, so your ribcage is translating, and that has to do again with the thoracic spine. Now after that, we're going to go down. We're going to go down from the ribs, and we're going to go to the iliac crest right there. So the iliac crest is this area right here of the pelvis. Okay? You're going to put your hands there. You can take another picture to see which one is higher, or you can do this in front of the mirror to see if you have one higher than the other one lower than the other one. When you have that, that means that there's lateral pelvic tilt, right? And that can lead to curves on the lower back. That can lead to pain on the lower back, this sacroiliac joint. That can lead to misalignments on the knee. That can lead to hip pain and a lot of other issues. Okay? Next thing, you're going to look at the knees. Most likely, if you have one side of the pelvis higher than the other one, you're going to have misalignments on the knee. The knees, one of the knees is going to rotate and collapse in, or you might have both knees going in. So you're going to look at the patellas, or the knees are going out, or you might have some rotation of the leg. Okay? Now, the next step is the foot. So your feet have to be straight. You don't want one foot going out or going in, okay? You don't want your legs collapsing. You don't want this, you want that. Okay? So you want to see that your feet are forward. A little bit open is okay, but not too much. Now from the side, the ear should be on top of your shoulders, okay? If your ear is not on top of your shoulder and your head is going forward, that's forward head posture. So your neck should have a curve from the side, okay? For the head to be on top of the shoulder. This is the front, this is the back, this is the head. The curve should be like this. This is called a lordosis, cervical lordosis. So the head should be on top of the shoulder. If it's going like that, that's forward head posture. Usually the shoulders will follow, and then the thoracic spine will follow, and you will start to hunch. Now, you can have a hyperkyphosis. This is too much curve of the thoracic spine, and you might be like this, but your neck still has some curve. Okay, so this is hyperkyphosis, this is forehead posture. And sometimes there are combination of the two. You have forehead posture and hyperkyphosis, and the shoulders are rounding forward. After that, we're going to go down and we're going to look at the pelvis. You have the anterior superior iliac spine and the posterior superior iliac spine. Now, this is on the front, right here, and the other one is right there, that bone right here that protrudes on the back. Usually, the anterior is lower than the posterior, but sometimes it's too much. So this means that you have anterior pelvic tilt. So you have something like this, your pelvis is going forward. That will lead to much curve on the lower back. That's called hyperlordosis. Right? That can lead to low back pain because of facet impingement. The joints will get impinged. Or you can have posterior pelvic tilt. And this is where your pelvis goes like that, posteriorly. And now you don't have a lot of curve. This is too flat. And that can start to lead to pressure on your disc and low back pain as well. The next step is to look at your knees. Okay, you don't want hyperextension of your knees or flexion of your knee. You want your knee to be neutral. You want your hip to be on top of your knee and the knee on top of the ankle, the malleolus right here. Okay, so this is what you're going to look at. Check if you have any of these conditions and go to the videos of postural conditions and start to do those exercises to correct. Take pictures now and then take pictures in a month after you start doing the exercise, after 4 weeks, 6 weeks, and you can compare.